Okay, so next let's start with the pleura and the recesses. So we'll be discussing the pleura and the recesses first, and then we'll move on to the lungs. In the pleura and recesses, guys, we basically need to discuss about that the types of pleura we have, the parietal and the visceral pleura. We've already discussed their development in the embryology part, and then we'll also talk about certain recesses which exist between the parietal and visceral pleura, and we'll also talk about the blood supply and the nerve supply of the pleura. Especially considering that the parietal pleura is pain sensitive, so we should know the nerve supply of the parietal pleura. Out of all these things, these are the most important here. So when we say pleura, so we have two parts. We got a parietal pleura and there is this visceral pleura. Parietal and the visceral. Before we go any further, guys, let us say if this here is the parietal pleura here, the parietal and the visceral pleura, they continue with each other at the hilum of the lung. Now, if this is the hilum of the lung, this is the point from where the blood vessels and the bronchus, they are going in and out. So this is the hilum part. So this is the exact point where the parietal pleura and the visceral pleura, they continue with each other. So of course the one with the black color I'm showing, this is the parietal, and the one I marked with one with the red one here, this is the visceral pleura. So one important thing that they continue with each other at the hilum. Visceral pleura adherent to the lung, so you will see that visceral pleura is going along with the fissures of the lung also, and in fact it even divides the lung into bronchopulmonary segment. We will come to that part. Parietal pleura is named based on the location, like a part of the parietal pleura extends above the clavicle, so it is basically reaching the root of the neck, so we call it cervical pleura. Then we got a parietal pleura facing towards the ribs, costa, we call it costal pleura. The one which is resting on the diaphragm, the diaphragmatic pleura, and obviously the one which is facing the mediastinum or toward the heart is a mediastinal pleura. So as I said, out of the parietal and the visceral pleura, it's the parietal pleura which further can be divided or in 4 parts. So we got a cervical pleura. If I try to mark them in here, now imagine if this is a clavicle, let's say this black line here represents clavicle here. So guys, this is number 1 in our list. This is the parietal pleura, the one which extends above the clavicle. Then we got the costal pleura, the one facing the lungs. This is number 2, that is costal pleura. This is the one which is facing toward the ribs. Number 3, diaphragmatic pleura. Diaphragmatic pleura. This here is the diaphragmatic pleura, clearly resting on the diaphragm. And number 4 is the mediastinal pleura. This is number 4, that is a mediastinal pleura which is facing the heart. That is a mediastinal pleura. So we divide the parietal pleura in these 4 types. The space between the parietal and the visceral pleura, the one which I'm highlighting with the yellow here, this space between the parietal and the visceral pleura is called as the pleural cavity. So this is what you call as the pleural cavity. The pleural cavity, which is derived from the intra-embryonic coelom, something which again we discussed in the embryology part. This pleural cavity exists all around the lung, of course, and it is usually filled up in the inspiration. But there are certain part of this pleural cavity which exist even after inspiration, and those potential spaces where the fluid can get accumulated are called as the pleural recesses. So we have the 2 major recesses. One is called as a costodiaphragmatic recess and one is a costomediastinal recess. Now, as the name suggests, you already know that where the costodiaphragmatic recess would be. The costo is here and the diaphragm is here, diaphragmatic is here. So that means the recess lies somewhere here. We call it costodiaphragmatic recess. Similarly, we have a costomediastinal. This is mediastinal, and obviously the costal pleura is like covering in front also. So the one which is along the anterior border is the costomediastinal, the recess. So let me talk about that also. the recesses. So we got the two main type here. One, we have the costodiaphragmatic recess. Costodiaphragmatic, I'm writing R for the recess, and there is one costomediastinal recess. Just to represent them on the diagram, let us once again say this here is the parietal pleura and there is the hilum. And that's the visceral pleura. So what you'll see that there is a large potential space lies here that is between the costal and the diaphragmatic pleura, and that's why we call it a costodiaphragmatic recess. And there's another recess which lies along the anterior border, which is called as costomediastinal. Although this may not be the best diagram to show the costomediastinal. Let me mark one here. This is costodiaphragmatic recess. This is costomediastinal recess. But as I said, this may not be the best diagram to show the costomediastinal recess. Let us consider a cross section, guys. If you take a cross section of the thoracic cavity, let us say this here is a cross section, and here is the lung. I'm just looking at the left lung because it is more prominent in the left lung here. That is the parietal pleura. I'm just looking at the left lung here. I'm just looking at the left lung, and here is the visceral pleura. So this recess which is lying here along the anterior border, this is the one I was talking about, is called as a costomediastinal recess. This is what you call as a costomediastinal recess. See why? Because this one is mediastinal pleura. This one I'm writing MP there, and this here is the costal pleura. So we call it costomediastinal recess, which lies along the anterior border. Although this recess is comparatively more prominent toward the left side because of the cardiac notch, but these recesses, the costomediastinal recesses, they get filled up in a normal inspiration only. So not of too much of clinical significance. The one which holds a definite clinical significance is the one which is called as costodiaphragmatic recess, because it is the most gravity dependent recess that you see. If there is an accumulation of fluid anywhere in the pleural cavity, so obviously that tends to come down, and that will come down to the most dependent part, and that dependent part is this costodiaphragmatic recess. So please note that the costodiaphragmatic recess is the most dependent. It is the most dependent part of the pleural cavity. It is the most dependent part of the pleural cavity. And this being a most dependent part of pleural cavity, so obviously it should be used for the pleural tapping also. But before we talk about the pleural tapping, we should know that till what level you will see the parietal and the visceral pleura here. Although we have discussed the surface marking for this pleura separately in the video section, but as of now I should tell you that when you look into the mid-axillary line, mind it, I'm not talking about mid-clavicle, I'm talking about mid-axillary. If you look into the mid-axillary line, the lowest extent to which you will see the visceral pleura extending here, the lowest extent to which you see pleural this is extending is the 8th rib, and the lowest extent to which this parietal pleura extends in the mid-axillary line is the 10th rib. This is the mid-axillary line we are talking about. So guys, this is the mid-axillary line we're talking about. That parietal pleura exists, or it stretches to the 8th rib in the mid-axillary line, the visceral pleura, I'm sorry, and the parietal pleura extends till the 10th rib in the mid-axillary line. So obviously, the needle for the pleural tapping should go in between these spaces only. That's why the pleural tap in mid-axillary line, is to be done mostly from the 8th intercostal space. From the 8th intercostal, could be 8 or 9, 8th intercostal space. 8th intercostal space will be below 8th rib, na? You're looking 8th rib. So Between 8th and 10th rib, what you'll see the 8th and the 9th intercostal spaces. So you can do it from 8th or 9th. The 8th is more preferable answer that is quoted in the textbook. The 8th intercostal space, we use the pleural tapping in the mid-axillary line. Yes, when we do it from the paravertebral line, that is from the posterior, the level may change, but the question is about the mid-axillary line, so you got to go with the 8th intercostal space. So this is about a little about the pleura, that what are the types of pleura we have, and then about the extent of the pleura, and also about the two recesses here. I should also tell you quickly about the nerve supply of the pleura. And when it comes to nerve supply of anything, the embryology always helps you remember that, because the things which are derived from the somatopleuric lateral plate mesoderm, if you have not watched those videos by now, you will understand it later, or you should watch that part of the developmental video in which I've told you about that somatopleuric lateral plate mesoderm gives rise to the body wall structures like parietal pleura, parietal peritoneum, parietal pericardium. So their nerve supply and blood supply are also derived from the same nerves and blood vessels which are supplying the body wall only. Okay. And when you look at the visceral pleura, which is derived from the splanchnopluric lateral plate mesoderm, splanchnic means viscera. So whatever the visceral organ is supplied by the same nerves and blood vessel will supply the same visceral pleura also. So when you think of the nerve supply and blood supply, just don't try to mug them up. This is a simple logic behind it. I'm going to discuss this nerve supply of the pleura with you. And once again, I'll make use of the diagram only, guys. This okay. So if you look at this, the most of this costal pleura, look at the part I'm highlighting, guys. Look, the most of the costal pleura. I'm looking at the parietal pleura only, right? Not the visceral. In the parietal pleura, most of the costal part and the peripheral part of diaphragmatic pleura. Look at that. This is all supplied by the nerves of the body wall. What are the nerves of the body wall I talk about? Intercostal nerve, and so this is the one which is supplied by the intercostal nerve. Intercostal nerve supplies this. What part? It supplies the costal pleura and the peripheral part of diaphragmatic pleura. Well, if I highlight this portion here, the mediastinal pleura, look at this, guys. This mediastinal pleura and the central part, or you can say the medial part of the parietal pleura, it is supplied by the phrenic nerve. It is supplied by the phrenic. It makes sense, yeah. Intercostal nerves are on the outside, so it will supply the outer side of the pleura. Phrenic nerve is running along the fibrous pericardium. It is inside. It is running from the mediastinal region. So that supplies the mediastinal pleura and the medial part of the central part of the parietal pleura. So what do you see, that intercostal nerve and phrenic nerve, obviously they are the somatic nerves, they are the body wall nerves, and that's why they are supplying what pleura? They are supplying the parietal pleura. It also tells me that phrenic nerve supplying the mediastinal pleura and also the central part of this diaphragmatic pleura, that if there is an irritation of this part of the pleura, that obviously because phrenic nerve supplies it, and phrenic nerve supplies it mainly through the C4, so that also causes a referred pain to the shoulder tip. You know that the region of the shoulder tip, it is supplied by the C4 region only. So the referred pain, it goes to the shoulder. It goes to the shoulder tip. There are other things also for which we have the, like diaphragmatic pain, we already know they are referred to the shoulder tip. Even the pain from mediastinal pleura and the central part or the medial part of the diaphragmatic pleura is also referred to the shoulder tip. So this is about, and clearly this is a parietal pleura we are talking about. So parietal pleura is pain sensitive. So the parietal pleura is pain sensitive. Now coming to the this visceral pleura. Now guys, if I just mark that, the visceral pleura. Visceral pleura, it is derived from the splanchnopluric lateral plate mesoderm. That's a viscera only. So it should be supplied by the visceral nerves. And when I say visceral nerves, that means the visceral pleura should be supplied by either by the sympathetic nerve or by parasympathetic nerve. Now, where the sympathetic nerves are coming from? They are coming from T2 to T5 sympathetic ganglion. T2 to T5 sympathetic ganglion. We know that thoracolumbar outflow is a sympathetic outflow. So, out of which the T2 to T5, second to fifth thoracic sympathetic ganglion gives a sympathetic supply to the visceral pleura, and parasympathetic, well, undoubtedly it comes via the vagus nerve. It comes via vagus. So look, the point is, when I see people like reading all these things from the book, they try to mug it up. There's nothing to mug it up. Just think about it. Think diagrammatically that where is the parietal pleura, what part of parietal pleura exists where, obviously what nerve will be there. If you think about the pleura on the outer aspect, it is obviously by the intercostal nerve. If you think about the parietal pleura in the inner aspect, then it is by the phrenic nerve, because phrenic nerve is inside. And when you think about the visceral pleura, which is not supplied by the body wall nerves, it is supplied by the autonomic nerves or the visceral nerves. So it is sympathetic and parasympathetic. When it comes to parasympathetic, there is no other answer than vagus nerve, obviously. That's the only parasympathetic nerve going beyond head and neck. And when it comes to sympathetic only, then you have to remember that precisely which ganglion are supplying that part. So it's not that difficult when you read it. It sounds like a bit confusing here, but when you try to represent the same thing on the diagram or try to understand it from the diagram, it's easy to remember. So this is about the nerve supply part. And the same kind of concept we can use of the blood supply also, guys. Even in the blood supply, you have to think that what part is derived from where. So obviously the parietal pleura, the one which is placed outside, is supplied by the blood vessel which are body wall blood vessels. Now, what body wall blood vessel? Intercostal arteries obviously will supply the parietal pleura. Then internal thoracic artery, again because it gives off the intercostal artery, the internal thoracic artery will supply it. Musculophrenic artery, if you remember, it was running along the margin. That should also supply this pleura here. And if there is any blood vessel running with the phrenic nerve, like phrenic nerve is supplying the mediastinal pleura, right? So similarly, mediastinal pleura blood supply is also coming from the blood vessel running with the phrenic nerve, which we already discussed, and those was pericardiophrenix artery. So once again, in the blood supply part, again, just don't mug it up, just think about it. So when you say parietal, so when we talk about the parietal pleura, it obviously will be supplied by what arteries? By the intercostal arteries. Intercostal arteries, well, intercostal arteries coming directly from the aorta. It is supplied by the internal thoracic artery. But we know that internal thoracic artery finishes in the 6th intercostal space. After that, it divides into the branches. And the branch which runs along with the costal margin was the musculophrenic artery. So musculophrenic artery will supply it as well. And the nerve which were arteries, blood vessel which are running with the phrenic nerve, those were pericardiophrenix. Pericardiophrenix artery will also supply. That is about the parietal pleura, the body wall. And obviously when it comes to the visceral, we think about the blood vessel which are supplying this. So it is obviously the artery that is a bronchial vessels. The bronchial artery supplying the lung. So obviously the same thing, the visceral pleura is adherent to the lung, is also supplied by the bronchial artery or the bronchial vessels. So this goes with every other thing derived from the somatopleuric and splanchnopleuric lateral plate mesoderm. If it is anything which is about parietal, whether it is pericardium or pleura or peritoneum, think about the blood vessels and the nerves for the body wall. If it is about the visceral, think about the splanchnic, think about the visceral, what viscera they are covering. Similarly, like if I talk about the visceral pericardium, so visceral pericardium should be supplied by the same blood vessel which are supplying the heart, because it is adherent to the heart. So it's very simple to remember these parietal and the visceral blood supply and the nerve supply.